A lot of times clinicians can get hung up on just the rate, but understanding volume, even if you're not measuring it, is important. So let's talk about tidal volume and minute volume. A normal respiratory rate's between 12 and 20 a minute, and we normally breathe in about 5 to 7 milliliters per kilogram of ideal body weight. But the generic number used for most textbooks is 500 milliliters per breath. That is tidal volume. It's just how much air we move with each breath. Now, imagine you were blowing into a balloon and capturing every one of those breaths. Well, 2 breaths would equal 1,000 milliliters, 3 breaths would be 1,500, 4 breaths would be 2,000, and so on and so forth. Now, if you did this for a minute, that would be your minute volume. So it's just the amount of air you're breathing per breath times your respiratory rate. Let's take a look. A normal respiratory rate, like we said, is 12 to 20, so we'll use the rate of 12. With a normal tidal volume of 500, that patient's moving 6,000 milliliters a minute, or has a minute volume of 6,000. Now, why is this important? Well, a lot of people aren't measuring tidal volume down to the numerical value, but understanding the difference between a deep, normal, and shallow respiration can help you be a better care provider. So, for example, let's say that we had a patient that was breathing 10 times a minute, but very deeply, and they had a tidal volume of 700 milliliters. Their minute volume's actually higher than the 12 times a minute at 500. Now, if we had another patient breathing 12 times a minute, but very shallow, with a tidal volume of 300, well, they would have a minute volume of only 3,600. Now, if we just looked at the rates, which one would you say isn't breathing effectively? Well, you'd probably say the 10, because we're not taking into account the depth of the breathing. Once we do, we start realizing that it's actually the patient that had a normal respiratory rate. Now, we could have went a lot further into this topic, but this is one of those concepts that a lot of new students struggle with, so I just wanted to throw together this short video. I hope it helped you, and until next time, stay safe.